Welcome back to The Shaky Gynecologist. Some of the most anxiety-inducing moments for me as a student and resident were on rounds, and the attending stops you in the middle of your patient presentation to ask a question. Instant spotlight. And if you're like me and don't love being the center of attention, your heart rate jumps immediately. Because there's a very real fear that the question they've just lobbed at you is one you can't answer. That you're about to say those three little words every trainee dreads. I don't know. During training, I don't know feels like a proxy for not being good enough. You see the disappointment on the attending's face. You see the other residents and students around you trying very hard not to look your way. And you silently promise yourself every single time that you will never not know again. Spoiler alert, you will. Repeatedly. And that's by design. The whole point of training is to figure out what you don't know, go learn it, and then know it. So what happens when you're out of training and someone asks you a question you genuinely don't know the answer to? It will happen. A patient asks about something you don't deal with every day, or wants to know something and you just can't remember in that moment. The old training reflex kicks in, and not knowing feels like failure all over again. Here are a few thoughts on dealing with I don't know in practice. First, take a pause and make sure you understood the question. It sounds basic, but it matters. Sometimes the question is vague, or you and the patient are using the same words to mean different things. Ask them to clarify, or repeat it back in your own words. So what you're really asking is, that might be all it takes to make the question answerable. Second, when it's reasonable, it's okay to make an educated estimate as long as you label it. By the time you're in practice, you've seen enough to make informed guesses about a lot of things. The key is to be transparent about it. For example, a patient asks, how often does this side effect happen? And you can't remember the exact frequency, but you're sure it's not common. You might say, I don't know the exact number off the top of my head, but it's pretty low. You're not pretending to know more than you do. You're giving them useful information while clearly marking the edges of your certainty. Third, and this is the most important, be honest. If you don't know, say the words, I don't know, out loud, but then immediately follow it up with what you're going to do about it. Let me look that up and get back to you. Let me check with a colleague. Let me think about that for a minute and make sure I give you a good answer. Patients are usually far less bothered by the fact that you don't know something than they are by the feeling that you're faking it. Not knowing is not the sin we were trained to believe it is. Pretending to know when you don't, that's where we get in trouble. So get comfortable with those three little words, because medicine is way too big for you to know everything. So those are my thoughts on saying I don't know. Let me know your thoughts in the comments. And don't forget to hit that like and subscribe button. I'll see you soon.